interweave some psychoeducation with another topic I forgot to ask you about, and this is the first is a little bit about the structure, but I want to ask you it's about what to practice in simulation training. There are, for example, in the Netherlands, there are some people who say you have to practice in the police training. You have to practice those events with high risk and very impactful outcomes, although they are not mostly happen to the officer, like a shooting incident. And there are other people who say no, because the police officer, he's the whole day, he's communicating. So de-escalation strategies and that what is most common in his work, we should practice. I guess it had also some terms in the medical literature, like HALO, I'm not sure.
HALO, yes.
Yeah.
High acuity, low occurrence.
Yeah, but
yeah. So this is an interesting question, isn't it? And I think it depends, again, not necessarily what you're trying to achieve in an individual sim, but what you're trying to achieve in your program. And there's no doubt, say, in emergency medicine, we have a combination of doing things that we do a lot of, but we really want to reflect on and improve and do well. And we also do some things that we might not get exposed to because that's what people are worried about, and they may need some experience. Like yesterday, we were doing a case of eclampsia, which is where a woman who's heavily pregnant has a seizure because of high levels of blood pressure and circulating hormones that cause a condition called eclampsia. Now, this doesn't happen very often, even in obstetric practice. It happens even less in emergency medicine. But our team was very grateful for the chance to practice, because if it does happen, you don't have a lot of time to respond and you need to do some things that are unfamiliar to us. So I think if you're talking about, say, an emergency department team, and you have to make choices about how to spend your training time, I think it's a mixture of those things. Obviously, in healthcare, education, there's also things to do with a curriculum. So sometimes you have external influences on your choices. And for our medical students, there's certain things that the curricular outcomes for the average medical student, people all need to do X, Y, and Z. And so they end up in our program. I think you need to put another lens through it, which is not everything lends itself to simulation. And if you want to practice interpreting electrocardiograms, don't do that in a simulation. Just get out some ECGs and put them on a table and discuss them with the students and go through it in a structured way. So I think your choices of this precious sim time should be what is important in terms of the outcomes for the institution. And that sometimes includes a few high acuity, low occurrence procedures, but it should include, I think, a lot of the everyday things that we know we still have gaps in performance. So I think it's a balance.
Now I'm a little bit in my head all those questions, because I started to move through the structure of simulation design. We were with the briefing.
Yes.
But now I did it myself. Now I ask you about what to practice in simulation training.
Yes.
And I have to ask you about adaptive expertise.
Yes.
Right now, because it's a fascinating topic, adaptive expertise versus routine expertise, and what it means for us as educators. And I can imagine that in the context of what we're talking about, like doing routine simulation content and doing new unexpected content and high acuity, what part is routine training and what part is adaptive expertise, and how do we define adaptive expertise anyway?
Yes, okay, great question. Right, so adaptive expertise tells us that although we may have some generic foundational principles on which we practice, that we will need to be able to apply them in diverse contexts, and that we need to have some skill sets in how we recognize when we need to adapt our approaches for new and novel challenges. So if we are trying to foster this adaptive expertise, First thing is we do need very deep knowledge of foundational material. So let's take the example again of looking after a patient with chest pain. And so you have foundational knowledge of how to interpret ECGs, how to take a history from a patient so that you can get important information. What are the right tests to do? What are the treatments to do, given various findings? And we could do a standard scenario that would challenge the team a bit to do that. But then what if this patient has low blood pressure? It's got some different context to it and some different decisions to be done and different ideas. What about if this patient is from a different age group? That might mean there's a different occurrence of causes of the chest pain compared to a younger patient or a middle-aged patient. So you start to see that one of the great things about simulation is that on demand, we can add in this variation, exposure to variation, that we know helps the fostering of adaptive expertise, particularly if you can help then people deconstruct and recognize these factors that have been important in adjusting our approach based on the challenge that we saw before them. So I hope that gives you a little sense of adaptive expertise, but also of how simulation is very well placed to help that.
Because there are many theoretical things happening at the same time. If in police training, there is now the ecological psychology and the constraint-led approach. It has even been studied in the Netherlands in nursing, in nurse education already, where you don't start, and this is very challenging, you don't start with fundamentals, but you start with a problem and trying to solve the problem, which of course is begging the question, how can you start without teaching fundamentals? So and at the same time, adaptive expertise comes around and also speaks, if I'm correctly, about problem solving, I think, and to find some underlying principles that you can apply. Yeah.
And look, I think to take your first example, I don't find these two things necessarily in conflict. I think you can have a problem-based learning approach, which is, here's a problem, and now let's identify what our issues are. What don't we know in this problem that will be necessary to find out if we're to solve it? So I think you can do that and build your foundational knowledge through problem-based learning, and then come back out and continue to build your knowledge and your skills in applying it through fostering adaptive expertise. So I don't think these two things have to be in tension. I think they can actually both be useful strategies for learning.
Yeah, that's great. Okay, so back to the scenario design and facilitation. Then we have the pre-brief and the briefing, and they go into the simulation. And let's say that this is a stress exposure simulation training. So with the explicit goal, for me, and I hope to hear from you, the explicit goal is I use the 3 R's to recognize, regulate, and reflect, but to recognize what's going on. And this is I recently came upon the research of Amishi Ya, if I'm correctly. She wrote a book, Peak Mind, and she talks about meta-awareness.
Yes.
And it's so great because paying attention to your attention, it's such a great concept.
Yes, it really is.
And so recognizing where your attention is, and if you are distracted or stressful, so then and then you can regulate it, and then you can reflect on the experience. But okay, then we are in the simulation. We deliberately try to get the learners into a pressure state, so to speak, and then to recognize it and regulate it. What are your thoughts about it, and what is important there?
Yes, so I like the breakdown, and the one we use is similar, where recognition is the first step. And it's not just recognition of the stress or the arousal, it's also recognition of the impact on performance of the individual and team. And I think those two things are related. They're slightly separate, but obviously closely related. But I think because sometimes you recognize the impact as a helpful way of recognizing the arousal and the stress. The second part to this recognition that we have really worked on because of some of our findings from research is recognizing the stress and the impact on performance in our colleagues in the team. So it's not just about recognizing your own physiologic arousal and the knowledge that you aren't performing at your best. It's seeing it in your colleagues and that influencing then your next steps, because the second part for us is mitigating the impact of that stress on performance, because we know probably we can only mitigate the stress or the physiological arousal to a certain degree. But what we can do is think about what are the strategies that mitigate the impact of that arousal on performance. And in our context, most of those strategies are related to the team.
Yeah.
Because so much of our high-level performance is done in teams, teams can either be a source of stress in themselves if they're not working, or they can be the most profound strategy, effective teamwork for dealing with the impact of stress on performance. So what we tend to do is encourage people to recognize, regulate their own as necessary, but also think about how do they, for instance, decrease the cognitive load of their colleagues if they see that they aren't performing at the level that they want. How can they provide some backup behavior to each other? And I guess given that often our groups are working in teams of 4, 6, 8, 10, 20 people, that's going to be more effective than just each individual person trying to do some square breathing.
Yeah. Well, this is very interesting because the tradition in the police training in Holland, we have a national program. We call it mental skill training, and that we translated it to the medical community. The emphasis is heavily upon individual stress regulation with all those tools. Of course, like the physiological tools, but also the self-talk and so on. But indeed, the team resource management principles are maybe more effective. I even think, and Dan Dworkis has a nice matrix, I think, it's so. I translated it as organizational resource management, team resource management, personal resource management, which, well, if you are too busy, if you have too few doctors, you can do what you want, but you get stress anyway. So at what level do you intervene? So you were saying now the team level interventions are at the foreground of the stress exposure training.
Well, I think there's nothing wrong with the individual strategies. I think that's well-placed practice and training for people. I do think that. So would not speak against the idea of mental skills training. I like that idea. I think what we know is that in our environments, that is necessary, but not sufficient to reduce the impact. So I would say this is a complementary and additional, but probably if you were looking for I don't know of any evidence about this, but in terms of the proportion or the capacity of a strategy to influence the outcome, I am biased, I know, but I would say the team strategies are probably going to outweigh the individual ones if you look at the power of people being able to assist each other in a team and mitigate that impact on performance. The organizational level is also relevant and outside in the moment. And I guess we don't spend as much time on that in the simulation, but we certainly work on what if you're feeling frustrated about how your system is not working for you, how do you actually recognize that might be a source of stress, and that might involve both your mental skills and one of your colleagues helping you to cognitively reframe where you're at so that you can focus on the task at hand.
So I think that's maybe also a good thing to ask yourself as a simulation designer. At what level what are we trying to solve? At what level? Maybe.
Yeah, and I think that's maybe why I'm a little bit biased as well towards the teams. Like I think the individual mental skills training doesn't necessarily require the kind of simulations where it does take a fair bit of resources of people and space and time in order to do that. So we have the opportunity when we do our team-based, scenario-based stress exposure training to really work on those teamwork interactions, where I would say often the individual skill sets, you can use techniques like mental rehearsal, and you can use techniques like people's just individual everyday practice. And so it may be that to get bang for buck out of your team training, you're going to be focused on the team level interventions that you can't practice on your own.
And so we also see how nuanced it is in a way, because, for example, in the Netherlands, the ambulance personnel they are just alone on their own, or they are with one colleague. So then and also the police officers mostly, they are alone or in. So it depends if you have a team. It's maybe that a conclusion. If it's heavily teamwork, then team interventions are more.
Totally.
Yeah.
Oh, yes. I think if you're working as a single operator or in a dyad, this training looks quite different.
Yeah. So then they are in their simulation training. And one thing I would love to hear you about is stress and learning. I have a colleague from Belgium, John Taverniers, who wrote his PhD about this, stress and learning and how they influence each other. So we want to induce, is that a word?
Yeah, that's a word.
We want to induce some stress, or maybe we could say pressure in the learning environment, so that they can work with it. But at the same time, does it help them in their learning? What are your thoughts about it?
Well, I've been heavily influenced by my Canadian colleague, Vicky LeBlanc, in this. She's written a lot, including about pre-hospital providers and first responders. And she, I think, has really helped dispel the myth that there is this single sweet spot of arousal for learning. And I think she's also helped dispel the idea that stress is on a single linear scale from low stress to high stress, and that's it. She talks more about emotions and emotional activation and says, look, there's so many different facets that you can be aroused but happy, and hence you're excited, or aroused but sad, and hence you're stressed. And so there's a lot of different factors going into exactly what your emotional state is. And it's not just on a scale of 1 to 100. It truly is a multifaceted description of an emotional state. So with those two things in mind, there's no sweet spot and it's complex. I don't know. I think we induce stress to a certain level to achieve a certain outcome at our peril, because I don't think it's predictable what individuals or multiple individuals in a team will do in response to any particular trigger. And I think this has been very influential in the way we've designed our stress exposure simulations. And I saw you talking to Dan, and you know, he's the kind of person that loves any old challenge, and he'll take it when someone puts a banana in his hand instead of a laryngoscope. And if someone then walks in and threatens them with a weapon, he'll go, wow, this is really cool. Yeah. Most people aren't like that. Most people are not like that. And so, and more importantly, mostly we can't necessarily predict how people will respond, whether that will be a growth activity for them where they learn to deal with an unexpected thing, or whether that will just be overwhelming and traumatizing. So where have I ended up on this? And partly through the research we've done, which is just choose something that you know is challenging and realistic, and then make sure the conversation is about what level of emotional activation that caused, the impact that that had on performance, and the efforts that we needed to take to mitigate any detrimental impacts on performance. So instead of trying to create crazy scenarios and somehow dialing up the arousal level of the learners, just say, yeah, make sure it's challenging. And I think that's just authentic, so that it is going to cause some level of emotional arousal. But beyond that, maybe just get realistic that we can't do what we would like to do, which is just turn the dial on some magic spot of activation, which gives us optimal learning. Because from everything I've read and from everything I've heard from Vicky LeBlanc, this super sweet spot doesn't exist.
No, indeed. And I also use the work of Lisa Feldman Barrett in this reel with what you're saying. You can be high in arousal, but it can be unpleasurable or pleasurable. So you don't know. But now I hear you talking about it, and I just recently read an article about, I think, from Vicky LeBlanc. Emotions, are they good or bad in simulation training? And
yeah, friends or foes of learning.
friends or foes of learning, indeed. And what is yeah, this is maybe too much a question, but do you regard stress as an emotion, or how what are
Yeah.
these?
So yeah, I wish you were talking to her here because she is the expert. It's often conceptualized as an emotion, but it isn't, I don't think, in the official kind of list. But I think most people think about, I like the term emotional activation. It seems to get me out of trouble with the people who care about the terminology. But I think it still means something to us everyday people who are not experts on neuroscience or emotions.
Yeah.
So I think most people understand the term stress, and that's why I don't mind using it. But I think the purists have got something to say about it.
Yeah. Two topics I want to talk within our time. That is coaching and feedback and the debrief. So let's start with coaching and feedback. So now the learners are in their simulation training, and I've done many things. I have done periods in my time as an instructor when they just did the simulation or the scenario, and afterwards we did a debrief, and then we stimulated self-reflection or giving feedback. But there was also some research from the Netherlands, from a professor who found that you can also coach during the simulation, and that learners appreciate it very much. So, of course, I think I know the answer, but it depends.
Of course it does, yeah. It depends, and it's a matter of being transparent with the learners. So we do both of these kinds of approaches, particularly with our medical students, where we pause and discuss, or even have coaching in the scenario itself with more senior people engaged in the scenario. So there's all sorts of formats that you can do in order to help people both practice and reflect on that practice. I would say that in our healthcare teams, probably most of the time we are waiting until the end and having a reflective conversation, because it just is logistically a little bit easier than pausing and starting again. And also they are at a level where they can progress through the scenario without needing too many prompts. And the reflective space is probably better to be put together. So I think there's lots of right ways to do this. It's about being clear to the learners what the expectations are, and to then in those conversations have I think, consistency of structure that will help learners understand, roughly the flow of this conversation, that makes it predictable enough so they know when is going to be the best time for them to give their thoughts and answer questions, and that navigate the interpersonal relationships in the room.
Yeah. So, for example, when we're doing our stress exposure training, well, we have ramped up the arousal a little bit, the emotional activity. They are busy with it, and they have some tools. But then we're looking at them, and for example, there is a nurse who is tuning out, so to speak. And we see it, but then we wait until the end for the debrief to talk about it. Well, at the same time, I think she is tuning out right now, so she's not using her tools. She's offline. Maybe I could help her better now than later. So these are the kind of trade-offs I come across.
Totally. And I think it's particularly hard in groups because people aren't all behaving the same way at the same time, of course. But I think sometimes if you observe something like that, it just becomes a rich source of conversation, the debrief, about why that was. So sometimes we rush to help on the assumption that we know the reason why people are doing what they're doing, and it's because they lack help from us. And that may or may not be the reason why they're doing what they're doing. So I think maintaining that curiosity about performance is probably the key. And I think it depends on the context as to which approach you take. But I'm a believer in lots of right ways rather than lots of wrong ways.
Yeah. There is a famous man in police training. He's Ken Murray. He wrote a book, Training at the Speed of Life, and he talks about some intervention points during simulation training. I'm curious about your opinions. What are there intervention points in a simulation where you need to intervene as a facilitator for some reason?
Yeah, so I would say for us, there's a small number, but it's usually just where there's a physical safety risk that you see. So, for instance, if someone was about to defibrillate a real person or one of their colleagues, and there was some physical safety risk, we would stop the scenario or somehow mitigate that risk. I think if it's an error that someone makes, we don't tend to stop. We tend, though, to make sure that we discuss that in the debrief, largely because, so we don't avoid the conversation about particularly things that might be dangerous if they were done in the real world. But we wouldn't necessarily stop the scenario in order to do that. So I think making sure we talk about issues that of performance that's problematic is important, but it doesn't have to be the end of the scenario.
And this is challenging for me from the point of most of the time, in my experience, we, especially within the police, we did a simulation at the end of the training. Then we had a debrief, and we bring some points. Victoria, this was going wrong, and so on. You of course you acknowledge it and go home.
Yes.
And
well, yeah, I think one of the things that one of the formats we do with our medical students that is extremely good is something called Live, Die, Repeat, which is a sort of like a rapid cycle deliberate practice, which is you do a bit of a scenario, you pause, talk about it, and then if there is something that might be worth doing better, go back and do it again. And I think you're right. I think often sims get used as a capstone at the end of an educational activity. And I don't think that's the best place for them. I think often doing it in the middle and getting a chance to try again is a more powerful thing, because it's one thing to have a nice chat in a debrief and go, yeah, I'll do that differently next time. But it's much more powerful if you get a chance to have a go.
Yeah. I think you like to talk with Professor Chris Cushion from the UK. I'm not sure if you already met him.
No.
Because he is very explicitly he's a professor in coaching and psychology, but also did research within police. And his view on scenario-based training is, I quote him, the scenario is the training. So everything finds place in the scenario from the start. And that's a very, very interesting concept.
Well, he doesn't believe in debriefing.
Yes, but everything happens in the, so they start in the scenario, and everything happens in the scenario. They can pause and stop and pause and stop and pause and stop, but the scenario, so the scenario stays there. I think
it's an immersion. It's an immersion. Yeah. Oh, okay, interesting. I'm sure that could work too. Like, I think all these things, it's a matter of having the right intent and clear idea about what you're trying to achieve, and then some intentionality about the techniques that you're using as a facilitator. But I hear all these interesting creative ideas, and I think in the right hands they can all work, and in the wrong hands they can all be disastrous.
We have 2 topics left within these last 10 minutes. I love to talk, but if you have maybe you have a topic you want to talk about, then it's also okay.
Oh, you keep on giving me such good ones, Eric. I'm happy to be guided by you.
So the 2 topics left are the question of feedback and the question of the debrief. And with regard to the feedback, I wrote already a blog about the article, and you were so nice to give some comments, and people loved it. So feedback literacy.
Mm-hmm.
We give people feedback, but what is happening, and how do they deal with it? What was the main message of the research?
Yes. So, well, I'm indebted to many expert researchers in this field, of which I wouldn't call myself one, but I love to read what they've done, and I've been loosely involved with some of their work. But I think we do have a few problems with feedback, and one of them is that we view it as unidirectional. The senior person tells the junior person what they should have done, and that's feedback. And it doesn't matter who's doing it, it's transactional. And I think both those things are incorrect. I think feedback is always relational. So it does depend a lot on what is the relationship between the two people who are reflecting on performance. And then I think ideally and most effectively, it is, to use an overused term, it's co-created. So ideally, learner and teacher or supervisor and practitioner decide first what it is that they want to focus on and what they want feedback on, and maybe even have a conversation about how they like to get that feedback in terms of timing and style and other things. But I think the bit that you really touched on there, this work that Christy Noble and team have been doing, is about feedback literacy. And we spend a lot of time in healthcare training senior doctors or any other profession how to give feedback to juniors. Whereas this flips this on its head and says, actually, this will be more effective if you train the juniors to be able to extract the feedback from the seniors. So what does that actually look like? Instead of just waiting to be told that you did a good job or not, you actually go to your senior and say, hey, you just watched me look after this patient with a head injury. How do you think I went on allocating roles in the team? So the senior doesn't need to have any skills at all in feedback. They just need to answer the question that this very feedback literate learner has asked them, because they've thought hard about what they want to get feedback about. They've asked the right person who has some experience and knowledge about about an expected performance here, and they've asked them a very good and timely question. So feedback literacy is about getting people better at getting their feedback, recognizing there's still appropriately some skills and relationships to put around this transaction that will also benefit the feedback.
Yeah, great. And there was also a mention about the changing of the mantra, from changing it from getting active with feedback to pick your moments, I guess. It was something like that. Yeah.
Yeah, I think
it's not that easy in the real world to extract some feedback.
Yeah, well, just like everything, the more explicit you can be for people, the easier it is for them to change their behaviors. Yeah.
Well, last topic, and this is such an important topic. So we have only a few minutes for it. That's a pity, but it's the debrief. And what I found in my experience is that most of the time the debrief is not that very structured. It goes all around, and there are of course some structures. Like the OSIM, they use the Steinweg debriefing, Steinweg.
Okay. Mm-hmm.
But there are also the Pearls debriefing. What are your thoughts about what is important in the debrief?
I think there's three things that are important. One is deciding what to debrief about. The second is having a structure, any structure. And the third is having some conversational techniques that promote reflection and conversation and discussion of performance. So in turn, what to debrief about. The key tip here is a small number of things. If you've just watched a scenario, you've got to pick 2 or 3 topics only if you've only got a 20-minute debrief, so that you can do them justice. In our context, usually that means one of the topics will be something a bit more clinical and technical, and one of the topics might be a bit more teamwork. And maybe there's 2 topics. Maybe we can talk about communication, and maybe we can talk about sharing the mental model. Who knows? So choose a small number of topics and be disciplined. A structure, I like Pearls. It's what we tend to use. But I think the key thing is just to have clear phases that you can becomes it's cognitively offloading for you. If you think, okay, first I'm just going to start with a reactions phase, ask people how they think it went, any reactions to the scenario. Then I'm just going to go through the facts of the case. And then I'm going to move on and say, okay, we've got 2 things we can talk about. One is about the management of head injury, and the other is about how as a team we share a mental model. So you've got an agenda, and that just means that you don't stress so much about what you're trying to do. So I'm there for any kind of structure, and then staying a bit consistent with it so that whoever you're working with, whether it's learners, other facilitators, they come to recognize the structure, and everyone kind of gets used to where they can join in that conversation. And that's very supporting for people's participation. And then finally, and this is a hard one, to teach and learn, I think, and that is to have some conversational skills. And often this includes the ability to ask good questions that do promote discussion of performance. And that is a longer podcast, I'm afraid, Eric, but I think there are a few keys to it. And I think a lot of people get tied up in over specifying this. I think if you are genuinely interested in why people did what they did, that will come across in your questioning. Yes, I know a lot of names of different questioning techniques, but I think the key thing is just to say, look, how enjoyable. We just spent 45 minutes on a podcast. I like your tight timing. Tell me a bit more, Eric, about how you go about structuring your podcast so that we can have such a great conversation.
Yeah.
So, because I'm actually interested. So this comes across, and so you will respond in this debrief. If we're doing a debrief of this podcast, because you could tell I'm actually interested, and I would get to know a bit more about what's the basis of your behavior, rather than just saying that was great, mate, do more of it, or that was a bit not so good. I think next time do this. Yeah. So anyway, I think the point is there are some conversational skills that help, and that includes some practice and getting feedback from other people on our debriefing skills. So I know maybe that's a overly simplistic view, but that's my sort of
I don't
short
think
tips.
so. No, these are great tips, and I totally agree with it. I have the same, and the last point is especially great because I'm working also as a psychologist, and I came to this format by the great Carl Rogers and all those psychologists also. Just if you're curious and if you're curious and interested, you come a long way.
Totally. Chris Argyris's double loop learning.
Yeah. So thank you so much for this conversation. I learned a lot, and there are so many great things into. Did I forget something to ask you, or?
No, I feel like we've had a lovely conversation, Eric. I really appreciate your thoughtful questions, and I feel like it's been a great afternoon.
Thank you so much. And